The incidence varies based on the type, and so the one way to think about this is there's several types of subdural hematoma. First of all, it can be either spontaneous or it can be traumatic. So it can come from a trauma or impact to the head, or it can come from just a bleeding problem, or it can just be spontaneous. I've seen cases where people had spontaneous bleeding under the dura. Now the dura is the covering of the brain. It's a leathery covering that surrounds the brain and everybody, and it actually protects the brain. But the problem is, there's a hard dura, there's a hard skull, and the brain is very sensitive. And so if there's bleeding in between the brain and the hard covering, it can compress the brain, and that's where problems arise, and that's why it's an emergency usually. It tends to be more common in older people, and the reason for that is actually, well, there's several reasons. First of all, older people are more likely to be on anticoagulation medications, like things like Coumadin or aspirin or Plavix, medications that alter the ability of the blood to clot and promote bleeding. The second, older patients are in some cases more likely to fall repeatedly, hit their head, and develop chronic subdurals. The third reason is that the brain atrophies with age and shrinks in size and loses a lot of its water content. And you can see that plainly on scans from people of varying ages. You can tell an older person's brain from a younger person's brain. I can look at a scan and tell you immediately. In older people, the brain is smaller, and there's more space in between the skull and the brain, and the veins that bridge that space get stretched. And so when those veins are stretched, they're more vulnerable. And so for that reason, even a small impact sometimes can cause bleeding. Well, that's a little bit of an unknown problem. It's part of the aging process. That it's just as the skin becomes less elastic and loses water content, so does the brain. Well, an acute subdural hematoma, meaning a sudden bleeding, can be from trauma. It can be from a motor vehicle accident or an impact to the head or a fall. A chronic subdural hematoma in a child is most likely from child abuse. It's most likely from repeated blows to the head. That's really one of the only reasons we find for subdural hematomas that are chronic in children. And then there are other more exotic reasons. There are some children who are on anticoagulation for whatever reason, but it's much more uncommon than for adults. Well, that depends a lot on what the patient looked like before surgery. And so, without knowing the patient, it's sort of impossible for me to say that. But if someone has a good preoperative status and they're taken to the operating room and this gets taken care of and it's an adequate decompression of the hematoma, then they typically will do very well. If their neurological status was very poor preoperatively, then their outcome is usually worse as well. You would expect or hope that they would do better than that. So their exam would improve after surgery because you've taken care of the problem. Now it may not come back to baseline. It may not improve completely because often some damage has been done to the brain. In some cases, patients improve completely. It depends dramatically on the situation and the extent of the size of the subdural hematoma. Some can be very small. And some can be very small and we don't operate on them. All the time here at Grady, we're a trauma hospital, a lot of head trauma, and I would say the majority of cases of subdural hematoma that we see, we do not operate on. We observe, we repeat a CT scan at 24 hours. Usually it's not bigger, and usually the patient's stable, and we sign off. We say nothing operative to do. It's just like a bruise in any other part of the body. It can get reabsorbed. So, there are some people who use the word stroke to signify essentially any kind of bleeding or ischemia to the brain. It's a very broad definition. Most of the time, when doctors talk about stroke, they're usually referring to ischemia. And ischemic stroke is very common, the most common type of stroke, where there's a blockage in the blood supply to the brain. So either an embolus or a thrombus that starves the brain of oxygen and blood flow. and that starvation kills the tissue and causes damage to the brain. That's a different situation than a bleeding hemorrhagic stroke, which is the opposite. It's bleeding. Some patients can bleed spontaneously to the brain, often from high blood pressure, and that usually looks different from a subdural hematoma. That's actually usually deep in the brain, in the center. The subdural hematoma is on the outside of the brain. It's bleeding. It's pushing the brain, and stroke is either an ischemic insult, which is starving the brain of oxygen from a clot in a blood vessel, or it's a hemorrhagic stroke from bleeding deep within the brain.